Welcome back to the Mountain Morning Show. I'm very happy to have Dr. Adelson here from the Docere Clinic. Welcome, sir, to the show.
Thank you very much.
Terrific to have you.
Thank you very much.
I'm excited to talk about this because, you know, if I recall correctly, I heard a number once that in every 10 years, the total mass of knowledge in the medical industry doubles, which is kind of hard to imagine. But when you consider that, new therapies, new ideas coming up all the time, and certainly yours is running the progressive edge of that. There's no doubt.
Well, I think one of the things that's very interesting about autologous stem cell therapy, so first of all, the word autologous means donor and recipient are the same person.
Right.
So we're taking stem cells from one part of the body and putting them somewhere else. It actually is not such a high technology. It's something that's very, very simple that was in front of us all along, but we overlooked it because we're so mesmerized by all things complex.
Yeah, indeed we are, and certainly I think we're mesmerized by plants and things that we found and the medicinal values of different things. So we bring those who are sort of the go-to, right? We go out and look for stuff, try to find something to fix us, when maybe the answer is inside all the time.
Precisely, precisely.
So one of the things that was tried for quite a long time was platelet therapies, right? Talk to me about what was involved there.
Well, platelet-rich plasma is a wonderful modality, and from 2006 to 2010, that was all I did. It was 100% of my practice. Before that, it was something called Prolotherapy. So I'll start with Prolotherapy, which is the sort of the predecessor of stem cell therapy. I treat musculoskeletal pain conditions, so low back pain, neck pain, joint disease, arthritis, sports injuries, that sort of thing. And rather than applying drugs to try to mask the pain or jumping to the extreme end, which is surgery, the concept of these regenerative injection therapies is to heal the tissue, is to use the body's natural healing response. So Prolotherapy was the injection of natural substances that are simultaneously nutritive and mildly irritating directly into the damaged area to trick the body into thinking that it's been re-injured, thereby launching the body's natural healing response.
This is not uncommon to tell the body that there's a problem. I mean, we do that even with so much as removing a wart. We freeze that wart because by doing that, it sends out a sensory issue to the body saying we need help here in this particular area, right? And that's essentially, in a smaller way, what we're doing here, right?
Similar. I think the closest relative is probably something like laser or dermabrasion, some of the cosmetic stuff, which are actually causing a little bit of damage and irritation to the skin to trigger the growth of new collagen and new skin cells.
Interesting.
So then the natural evolution of prolotherapy was platelet-rich plasma. So it's taking peripheral blood, just a normal blood draw like you get at any doctor's office, concentrating down the blood platelets. Platelets are what are responsible for clotting after injury, everybody knows that, but they also release proteins that signal the regeneration of damaged tissue. That's how you heal after injury. Now the way that they do that is because they signal the stem cells that live in that location where the injury has been to activate. So in 2010, when I started using stem cells, I mean, instead of trying to take platelets to activate the stem cells, what I found is that in people with very advanced arthritis, the real bone-on-bone arthritis, they don't have stem cells left in the joint, and that's actually a major part of the problem.
Right, because not only there's none there to react, but the whole system has forgotten how.
Right.
Is that right?
Yeah, though if there are any left, they're not functioning properly. So what we do is we go to where there's still a robust population of stem cells, the bone marrow and the fat, harvest from those areas, concentrate the stem cells from the bone marrow, isolate the stem cells from the fat, and then if we're treating a knee, for example, we inject it into the knee. If we're treating an intervertebral disc, we inject it directly into the intervertebral disc.
Now, we mentioned two different areas where we're getting it from. So adipose fat is one place, right? And that was, for a long time, the main place that people were going for, correct?
Well, it's actually the other way around.
The other way around, so we start with, people were going to bone marrow first.
Right.
And of course, plenty of stem cells there. Right. But a little more, for a lot of people, it's a little scarier idea. They were a little worried
Doctors
about
and patients alike.
Both.
Doctors and patients alike, which is why a lot of doctors only use adipose.
Okay. So where did the I don't know, should we say the evolution come to taking it from adipose fat?
Okay, well, I started out as a bone marrow guy because it's been around the longest. It's
Sure.
been used for a long time. It's been used for other conditions for many years, and it's a very reliable source of both mesenchymal stem cells and hematopoietic stem cells. The downside of bone marrow is you don't get such a huge yield of mesenchymal stem cells, which are the important ones. From a 60 cc aspiration, you're going to get in the neighborhood of tens of thousands of mesenchymal stem cells. Now, from adipose, you can get in the millions.
Really?
Oh, yeah. It's a very rich source of stem cells. Now, the problem is that they're tightly adhered to the adipocytes. So we had to develop a method to loosen up the bonds between the stem cells and the fat cells so that when we centrifuged them, they were able to separate.
How do you do that?
Well, we use an enzyme called collagenase. So it's about a 45-minute process where first we enzymatically digest the fat, then we put it in a centrifuge, spin it.
And then we get our stem cells out of that.
Yeah. Now,
Wow.
I started doing the adipose-derived stem cells 2 years ago, a little over 2 years ago. And what I found was when it works very well. It works better than bone marrow. But I had a non-responder rate, about 1 out of 3 or 1 out of 4 people. It just didn't seem to work. So I kept very close progress of the people that I treated, doing one or the other over a period of 4 months. And then actually my dad came to visit, and I thought, well, what are we going to do with my dad? I want him to get the best outcome. So I combined the two. And I found once I did that with him, I realized, look, if that's what I'm going to do with my dad,
It makes sense.
I got to do it for everybody. Do
There
unto
you go.
do unto your patients as you're going to do to dear old dad.
Wow.
So then I started doing both, and what I found is that I got the consistency of the bone marrow with the augmented improvements of the fat. And this is all published in the Journal of the American Academy of Pain Management, The Pain Practitioner. I have this manuscript published.
Looking forward to talking about this more. We're going to take a quick break. We come back. We're going to dig in even a little deeper into the adipose fat, as it were, right here on the Mountain Morning Show as we continue our conversation with Dr. Adelson. We'll be right back. Welcome back to the Mountain Morning Show, continuing our conversation with Dr. Harry Adelson, who's here from the Docere Clinics, and we are talking about stem cell therapy. First of all, explain to me the origin of the name of the clinic.
Docere. So the naturopathic medicine has 6 guiding principles, one of which is docere. The word docere is the root of the word doctor. It's the Latin verb to teach. The word doctor actually means teacher.
Excellent. Well, that's a great choice of name then, for sure.
Yeah, the downside is nobody can pronounce it. So when we use answering services, they just have to say doctor's office because they just trip on it. And so, yeah, that was the one thing I didn't foresee.
Well, it's what matters to you. It makes sense, I think. It should be something that inspires you. And clearly you're inspired as you continue these cases that you have coming into the office, which we should talk about. What kind of people are coming to see you?
Well, we treat exclusively musculoskeletal pain. So about half our practice is spine. We do a lot of low back pain, neck pain, degenerated, dehydrated discs, post-whiplash syndrome, anything that has to do with the spine. And the other half are joints. And of the joints, we do more knees than anything, and we mostly treat arthritis. We have a small number of sports medicine cases, but we're really more of a stem cell clinic.
Sure.
And sports medicine, these are self-limiting things that frequently will heal on their own, or oftentimes we are treated with platelet-rich plasma. And there are other doctors doing platelet-rich plasma who are very skilled at it.
Right.
So we mostly get sort of the end of the road guys.
Yeah, the real serious cases.
The last stop before surgery, or maybe
boy.
they're not even candidates for surgery.
Doctor, when we talk about surgery here, these are invasive procedures that are out there. When it comes to surgery, this is a very good place to go before you consider that. What kind of talk to me about the types of things that happen if we're looking at the surgery as opposed to taking care of things a little bit ahead of time maybe keeps us from going there.
Well, let's just take the 2 most common things that we treat, low back pain or arthritis of the knee. With low back pain, when people have badly dehydrated and degenerated lumbar discs, really the only choice is fusion. And fusion, if you look at the statistics, they're dismal. It really frequently does not work, and often it makes the problem worse.
Or other ancillary problems that are worse. worse.
Anytime you undergo a major surgery, you have opportunities for really horrible things to happen.
Yeah.
So, and there are some and certainly there are some people who do very well with lumbar fusion, but they really are the exception, and those are not generally the people who come to my office.
Indeed.
Then in the knee, there's knee replacement, which you know, has a very high satisfaction rate overall. However, if something goes wrong, if it's one in a million and it happens to you, it's 100%, and you can have some very heartbreaking cases of things that can go wrong. The nice thing about stem cell therapy is the worst thing that happens is it doesn't help.
That's a great,
That's as bad
I think
as
that's a great alternative.
Mm-hmm.
You know, we talk about contraindications. That's a good one, right?
Yeah, I think so.
Yeah, I'd go with that for sure. Talk to me about the typical procedure. Somebody comes in, because I know they're thinking about this. They're like, wait a minute, you just said bone marrow.
Right.
That means they're drilling into my bone. What does it really mean? Well, how bad is this?
Okay, so there's two steps. There's the miniature liposuction called the lipoaspiration.
That's where we get our fat.
Nobody complains about that part.
Right.
Everybody
That's good
loves
to begin
that.
with.
Yeah, it's not particularly painful at all. It can you're sore afterwards.
Yeah.
It actually is. You have more soreness afterwards. That can last a couple of weeks, but you know it's not unbearable. It's just uncomfortable.
Okay.
The bone marrow aspiration itself. The reason that people are so nervous about it is because they think of maybe they have a relative who had a cancer bone marrow transplant. Well, this is very different. Yeah. This is not mini punctures in many different areas through the gluteal muscle, and this we really take our time. It's a single puncture. I completely numb it up. Placing the needle, you don't feel at all. When I aspirate the bone marrow, there's no way to numb that up. It's a very intense pressure sensation. Lasts about 30 to 45 seconds. Everyone gets through it. I've had it done to me. I know what it feels like. I've done over 3,000 of them. Now, having said that, we do have an anesthesiologist, and if people would prefer to sleep through it, then we can arrange for that as well.
But otherwise, outpatient procedure with a local anesthetic.
Yeah, I mean, I do 18-year-old X Games kids to 90-year-old grandmas, and everybody gets through it just fine.
Okay, so just a pressure thing that we got to get.
Yeah, it's just
a little bit of mind. This is a little bit of getting over the mind part of it.
It's interesting because it's negative pressure in the deepest part of your body, so your brain is telling you that you're being sucked out of a spaceship. You know, it's not anything you've ever felt before, so that's a major part of it, is just the anxiety, because your brain doesn't know how to categorize the experience.
Amazing. All right, so now let's talk about if someone were to think about their knee. My knee's in a lot of pain all the time. What do I do? What is the procedure as far as assessing the situation and deciding what to do next?
Well, the first thing, people contact the office staff, Wendy and Dixie, and they're very good at screening people, and they are very, very qualified to get an idea whether or not somebody falls into the category of being a good candidate. Once they feel that you're a good candidate, then we ask you to send in your medical records. If you have x-rays, if you have MRIs, I want to look at them. I want to actually look at the images, not just the report. We have you fill out just a very small amount of paperwork. Then we do a consult. For locals here in Park City, clearly we do it in person. For our Canadians, for the people in...
Yeah, you have a lot of people coming down from Canada
We have
to see
a lot of Canadians, and we have people from South Florida on up to Alaska. I mean, we get people from all over. Because there's very few people who do this, and there's even fewer who have any experience with it. And we've been doing it quite a while. We've done a lot of cases.
All right, so they figure out that they're a candidate. They come into the clinic. This is going to, once they're ready for a procedure, this is going to take, what, a few hours?
Yeah, depending on what we're doing, start to finish, hour and 15 minutes to 2 hours. Also depends if they choose to be sedated or not.
Interesting.
That adds a little time.
Now, the location is here in Park City. You used to be in Salt Lake. You moved up here when?
In 2011. I was in Sugar House from 2002 to 2011, then moved up here. We're in the, it's, what is it, the Skull Candy building, the Rossignol building, and then the Docere building, but nobody calls it that, which
we should from now on. Harry Adelson, it sounds like this is very interesting work that you're doing. I'm sure every day brings you some satisfaction.
It's tremendously gratifying. I
bet. I mean, you see people that are feeling better and healthy. That's awesome. It's always a good thing. Well, certainly appreciate all the information about it. I still have many questions, so maybe we'll bring you back again to talk about it a little bit more. It is the Docere Clinic, and again, stem cell therapy. It, as you said, it may not seem, it may seem cutting edge, but really, this is your own body. So keeping things internal and fixing things up. So you can check them out on the web at
DocereClinics.com, DOCERE clinics.com.
All right. Thank you so very much. We've got more coming up here on the Mountain Morning Show right after these messages.